This one is about Pillar 3, which is risk reduction and resilience education. That's Pillar 3 of the Comprehensive School Safety Framework. Um, in Pillar 3, we're really talking about educators and curriculum developers and teachers and children who are engaged in the learning process. Whereas in the other two webinars, we tackled safer school facilities and school safety management. This one addresses education itself, risk reduction and resilience education itself. Our agenda today, we have 5 presenters for you. I will be presenting on the background on public education and public awareness key messages. Bonnie Haskell will be presenting on the Kids Activity Kit from IFRC. Anva Ratzon will be presenting for ISRAID on COVID-19 Toolkit for Parents, and Carolina Andrade will be presenting for ISRAID on COVID-19 response in Mozambique. And then Dana Yari on COVID-19 response in Dominican Republic. Oh, Dominica, forgive me. We got that wrong on the slide. She's presenting from Dominica. And then afterwards, we'll have an opportunity for Q&A. What I would like to ask you, please, when you are doing the Q&A, is your access is to the chat box, and so that's where you are going to be asking your questions, please. And if you have a question for a particular presenter, please name that presenter in your question so we know who to give the microphone to respond. Okay. Thanks very much. Good to see you, all of you. Just a little bit about GADRRRES itself. GADRRRES is the Global Alliance for Disaster Risk Reduction and Resilience in the Education Sector. We have 14 members at the moment, hoping to expand, and 2 regional and country level organizations. So as you can see from the logos on the right there, we are a combination of United Nations agencies and international non-governmental agencies and a couple in between. Members are working to ensure that duty bearers are able to protect learners and education workers from death, injury, and harm in schools, plan for educational continuity in the face of all expected hazards and threats, safeguard education sector investments, and strengthen risk reduction and resilience through education. As you can see, the 3 webinars have covered the 3 pillars of comprehensive school safety. They will all be available in recorded form. The first 2 are already available, and I think you can access them from the GADRRRES website, or you probably will also get an email that tells you when, how to access the recordings if you want to share them. And this will be, recording from this will be available in a couple of days. So we hope that this will meet the objective of introducing Pillar 3 of the CSS framework and its relevance for COVID-19, and share some case studies on how Pillar 3 applies and is adapted in COVID-19 response, and how we can build on this particular moment in history and time, not only to build back better, but to build back in with resilience built into all hazards. So I'm going to jump into some of the history of how we've been involved in this. And I'd like you to know about the Public Awareness and Public Education for DRR, Action-Oriented Key Messages for Households and Schools, which is a publication of IFRC and Save the Children, 2 very active GADRRRES members. And it's, well, I won't jump the gun. So it was developed in order to start to meet our needs to share guidance and have an evidence foundation for our work in Pillar 3, risk reduction and resilience education. Now, going back to about 10 years ago, what we realized is that there was a demand in the context of the Hyogo framework for action for quality materials for public education for risk reduction and resilience. But we didn't really have a go-to place. So what was happening is really that people were hopping onto Google, and whatever came up in the first page of a Google search seemed to be the source for public education. And that didn't seem to be a very strong evidence-based approach. So we did a great deal of research, desk research, into all of the global messaging that was taking place, particularly those that were already consensus based, and groups of experts who had gotten together to try to refine this. And we did end up being able to source, 300 different sources of information way back then at that time, and many more now, but they were all different and all over the place, and we had to look and synthesize for what they had in common. So we started that work many years ago, and we've had a second edition expanded that you'll hear a little bit more about. So the Public Awareness and Public Education Key Messages document consists now of 4 parts. You can get this document from the GADRRRES website, by the way, under the Pillar 3 resources. You'll find a whole box devoted to that with all of the links in it. So the 4 parts of the document are key messages for all hazards, family and household disaster prevention. We discovered that the way to simplify this for people was not to tell them that they had to have 9 different plans. If they thought about this from an all hazards perspective, they would basically have one plan, and then in part 2, we could cover the hazard specific key messages. Now there's a 3rd part on child protection and emergencies, and a 4th section on standard operating procedures for disasters and emergencies in schools. The intention of this whole document is to be a global template from which each country or potentially region can adapt and adopt the messages that are appropriate to their context. The approach in these documents is a little bit different than the historic approach in our field. The historic approach in our field is what's called a laundry list. It sort of comes from we, the experts, know everything, and we're going to give you a long list of things that you are supposed to do. Unfortunately, that's not a very memorable list, and it's not very empowering, and it's pretty hard to remember all the things on the list. But what we found from the research is that there are 3 types of activities that we all engage in when we're working on disaster risk reduction and resilience. They're grouped together. One area is assessment and planning. These go hand in glove. These, don't separate them ever, because if you do assessment without planning, not much point. If you do planning without assessment, not going to be very good planning. So we want those 2 to always be, married. Then there's mitigation or protection. That's where we actually make things safer by what we do. And the 3rd area is what we do because we're not perfect in the other 2. So response capacity development is there just to pick up the pieces of what we couldn't cover in our assessment and planning and mitigation and protection. Now, we had often found that in educating the public, we were jumping from assessment, which was sort of like, oh, terrible things are going to happen, to response capacity, which was, oh, you should have a first aid kit. And we weren't too happy with that. It was just way oversimplified and missed the real the content. So when we went to this approach, we found that it applies well both to household and individual planning, as well as to institutional, workplace, and school, as well as to government and policy. Each does different things, but they all break down essentially into those categories. So the PAPE Key Messages is intended now as a public awareness and public education campaigns reference. It's intended as a key reference for all social and behavior change and information and education materials that we might develop, and as content for formal curriculum and informal education for risk reduction. Who should use it? Well, we've found already that instructional designers and video developers are making very good use of it all around the world, from Latin America to South Asia to Southeast Asia and the Pacific, and probably elsewhere as well. It's also very valuable for games and apps content developers who can check the content that they are trying to infuse. by referring to the source messages. So we've seen quite a bit of that that's also explicit. It should be used by social and behavior change materials designers, or now I think in public health, they're referring to risk education and community engagement, right? RCCE, risk communication, community engagement. Whatever is your acronym, um, these materials are extremely valuable because PAPE key messages are action oriented, evidence based, and consensus based key messages, which means that in the communication of them, you actually have the tool for measuring your impact. We actually, we're telling people what they need to do, and then we can check up to see what their progress is in doing them. And some of you are probably aware that progress in taking action for risk reduction goes through the stages of behavior change that are quite common, which is first we think about it, then we plan to do it, then we actually do some of it, and when we get really good at it, we maintain the doing of it. So we also don't have to measure this just in terms of yes or no. We can actually measure to see if we're progressing on the continuum for behavior change. The resource can also be used and has been used for public awareness and public education campaign development. So that's the other value. And finally, researchers, which essentially I just told you about. So researchers are also putting this to good use. The template has been adapted and adopted in several countries now. It starts with doing a translation and then looking around in the country for what messages are already being communicated and distributed from the duty bearing and expert agencies, and doing some comparison. And then I'll tell you a little bit more about how the adaptation process works. You might be wondering, well, what about inclusion? Are you taking care of inclusion? What are the messages for people with different disabilities? Well, when we consulted with the major disability organizations of people with disabilities, they did not want us to have separate messages for people with disabilities. They wanted inclusion included. So that indeed is what we did, and inclusion is included throughout. In the first edition, in addition to the all hazards messages, which do cover structural fire, household fire, the most common, disaster to hit individual families, we also covered earthquakes, floods, tropical cyclones, wildfires, pandemics, and droughts. Pandemics. We'll come to that in a second. Um, in the second edition, we added extreme heat, extreme cold and winter storms, landslide and debris flow, tsunami and storm surge, volcanic eruptions, hailstorms, and chemical, biological, radiological, and nuclear hazards. And we are still at work adding and researching more messages to come on road safety, water safety, air pollution, and power outage. So you caught here that we did include pandemics. This was not a big surprise to us, sadly, as it was to others. And when you find the key messages, Obani's just kindly put the link for the key messages into the chat box, this particular link that I'm showing you right now. On that page, you will see that there is a definition and just a very short overview of what pandemics are and what this applies to. And in fact, there are a number of different types of pandemics, and you'll see that in a second. So the sections of these key messages are, again, the assessment and planning, the risk reduction, and the response capacity. And for each of these messages, in the left-hand column, you'll see the dark gray column. I've reproduced that on the right here. And these are the really core, simple messages. Protect your sources of clean water, use latrines, vaccinate your children, stay informed by local health authorities, keep your community informed, keep your communities clean, keep your communities safe, and so forth. In the second column, that's of course going to be way too small to read, are the contextual details for how exactly to do that. So In the mitigate risk section, the pandemic messages are fairly complicated. And the reason for that is that we have 6 different categories for how to mitigate risks. We have one general section that applies to pretty much everything. That's the use clean and safe water resources, practice good personal hygiene, dispose of human and animal waste safely. Those are the sort of core messages. And then we have specific messages for airborne diseases, blood or body fluid borne diseases, zoonotic, vector borne, and foodborne. And again, we have messages here for airborne diseases, which is, of course, what COVID-19 is. And in airborne diseases, for mitigating risks, the core messages are about, no surprise, wash your hands, cover your mouth and nose when you cough or sneeze, keep your distance, avoid and limit close and unprotected contact with sick people. Now I think we know that we would probably add, or people who may be contagious. Dispose of waste and separate and care for your sick. These are the core messages for all airborne pandemics. And then we have the third section, which of course is on prepare to respond. And these two will be of no surprise to anybody who's followed any news of the last 6 months. So the reason that, we bring this up now is that this is not our first or last disaster. We really want to learn from this and apply our best knowledge to whatever else is coming our way, the things that we can more or less expect. And so we would like to encourage and urge you to find out whether your country has adapted and adopted the key messages so that you have access to this for all of those hazards. And if not, we would like to encourage you to contact IFRC or Save the Children for us to work with you to help you adapt and adopt these key messages for your country. The adaptation and adoption process that we go through, typically we start by Save the Children and IFRC together approach the National Disaster Management Organization to make a preliminary plan. We check out who the subject matter experts are on all of these topics in the country. We make sure that we've gathered together all of the current messages that exist, and we prepare the key messages for review so that the messages get translated into the national language, and we do a comparison to see what messages are already going out there and what needs to be improved. Then there are a couple of ways to go after that, either a 2-day national workshop where we bring a group of key subject matter experts to the capital city. That's fairly effective in a smaller country. In a larger country, sometimes we do those workshops either over a 6-week period of time. We may do some of the consultation online. In China, we opened a website to gather the expert input from all over the country and so on. And then through those workshops, now we know how much we can accomplish both virtually as well as face to face. We compile, edit, and fine tune the inputs, and then we can finalize, publish, and distribute the messages. In the face to face workshop, we start with the all hazards messages because one of the things that we've seen in most countries is that the experts on volcanoes and the experts on cyclones don't usually have a chance to get together, and they may not actually be aware of the commonalities to the messages that they'd like to see out in the public, and some of the confusing differences maybe in the way that they talk about their messages. So we start them all off on the same page with the all hazards messages, and everybody goes around the room, and these things are all blown up on the walls, and they mark each message as to, is this a must-do message for us in our context? Is it a should-do message? Is it a, nice to do, but not strictly necessary? Or is it just not applicable? The avalanches, not care so much in those countries that don't have them. Actually, we don't even print them, of course, in that situation. But okay, then as we go through, we put together tables. One table tackles the assessment and planning, one the risk reduction, one the response development, and then based on the voting that's already taken place, the group splits up and works on refining those key messages and getting the language just right in the local language and plastering the whole thing with Post-it notes and details. And then they do round robin and move around to the table so everybody has their inputs on everything. On the second day, or if we need to do separate workshops, then we divide up into the subject matter expert groups, typically hydrometeorological hazards, and they take care of, the storms and the floods and so on. And then the geological hazards, and they take care of the earthquakes and landslides and so on. And they do tsunami, but there's a little bit of overlap. They both do tsunami. And then we have a group for the health hazards, the chemical, biological, radiological hazards, and another group on school safety and child protection and emergencies. I don't know what'll happen when we do road safety. We'll probably have, another group of people coming in that haven't typically been involved before, the public safety folks. And similar air pollution will probably go into the health hazards. And then when the whole thing is over, we convene to decide on the next steps. So why would you do that? I think I made the case. I hope I made the case. And I just want to finish up by showing you what it looked like when we started this process with subject matter experts in China. And I'm delighted to say that, even in this pandemic, Save the Children was approached in China by government authorities to help in crafting the ongoing and long-term public health messages that accompany pandemics. And we've been supporting also on messages that are being prepared by INGOs to use in other countries as well. Okay, with that, I am delighted to hand you over to our next presenter, Bonnie Haskell.
Disaster Preparedness Center, and I lead our youth preparedness file at the center, and I help support our 192 Red Cross and Red Crescent National Societies with their school safety and youth preparedness work. So I think that Marla did a really excellent job of detailing the work of GADRRRES on the public awareness and public education for disaster risk reduction key messages. And as she mentions, it's taking these messages and putting them into practice. In connection with that, I'd like to introduce and talk today about a particular initiative called the Kids Activities Kit. And this kit integrates those PAPE, as we call them PAPE, key messages that we discussed and translates them into a child-friendly language and approach. So we launched this kit, this Kids Activity Kit, back in late April, specifically for COVID-19, and we launched it in partnership with those that you see on the screen. Save the Children, British Red Cross, American Red Cross, IFRC, and actually a couple other reference centers at IFRC. And this is a kit of activities and games that kids and families can do together or alone in understanding the coronavirus, protecting themselves, protecting others, and just coping. But we try to deliver it in a collaborative and fun way. So it's truly designed to foster a sense of preparedness amongst kids, particularly in their families or households, and social cohesion across communities. So let's see. On the next slide, talk a little bit about challenges, because this kit stems from 3 identified challenges, many of which actually won't be new at this point, but I'll highlight them briefly for context. So the first is that as schools have closed worldwide, it's pretty clear that the virus is not only a public health crisis, but it's an educational crisis. And it's just a crisis in many respects for many families. And as many of us know firsthand, these school closures can place a really significant strain on families and households as they balance homeschooling and working from home, and perhaps even being on webinars as children play in the background. And parents really do want to keep their children engaged and learning and protected, but they also want to get their work done as well. And a second challenge is, as we're all pretty aware of, children not only need engagement, but they may be confused. They see everyone wearing masks. In fact, even when I was out this morning, some kids still point at my mask while on the street, and they might be unsure of what is happening. They may be asking questions, and there's a real need for safety information that makes sense to them and engages them in order to process and adopt the advice. So looking into this, we realized that there is a lot of guidance out there, but it's often crafted for adult understanding. I would say best case scenario, there's a lot of posters that could be seen as child-friendly, which is great, of course, but we know that children learn by being hands-on. And while school is out of session, either part-time or full-time, this presents really, I think, an important and exciting opportunity to really make learning fun as an informal means of education around disaster risk reduction and resilience. And yeah, so another identified challenge is that the activities that are engaging and are available are spread across many platforms, even across many of our websites at GADRRRES and our organizations that have great activities but haven't consolidated them in one approach. These activities can be hard to find and hard to sort through when they're in so many different places. So in response to these challenges and in our strong commitment to the PAPE key messaging, we realized we could enable the PAPE key message understanding and safe behaviors by offering playful activities for children on how to be safe, and that we could offer them in an inclusive and accessible way. So on the next slide here, with this goal in mind, and actually I'm going to paste it into the chat box right now, is we created this Kids Activities Kit, which are composed of activity cards, which are really postcard-sized cards that are highlighting, each card highlights a new or adapted activity and game around COVID-19 learning. And they're formatted as cards for easy sharing. And these cards are intended to be fun and child-friendly. And breaking it down more, these activities currently range across 4 themes. So first of all, they're games around protective actions, like how to wash your hands thoroughly, or how to cough in a proper manner, or practice good hygiene. All key messaging coming from PAPE and WHO, IFRC, all of our key trusted sources. But these messages are synthesized into being communicated in a fun way for kids. Secondly, we offer exercises and games around mental wellness, mental health. These provide really easy to do techniques that kids can do to just better understand and learn about their feelings, but also learn how to manage the stress they might be feeling. And third, and I think this is an important one that often is forgotten, there are a lot of cards around acts of kindness. It also aligns actually with Pillar 3 of the CSS framework, because a sense of community and social cohesion is important, particularly now more than ever. And these cards encourage pro-social behavior by focusing on how kids can be kind, how they can be empathetic, how they can practice acts of kindness, and how they can understand what it's like to care about others and want to protect them as well. And a fourth category is other disaster risk reduction and preparedness activities, because as we know, hazards do not happen alone. They don't happen in a silo. So we offer activity cards around general and hazard-specific disaster preparedness, like creating challenges amongst youth and playing disaster apps, some of which Marla showed earlier, and some apps that we've created. So it's important to note that these activities really build upon key messages that are evidence-based, the PAPE messages. They highlight already impactful activities created across partners, and they take an approach in communicating them to children also in a way that's evidence-based from educational specialists. And they were created, as I mentioned before, in close partnership with Save the Children and our national societies, such as British Red Cross, which has been really closely involved. And I'll highlight some of their cards and activities in a bit. But just to talk a bit about how these activities are formatted, they are broken down into clear, step-by-step instructions. They're not too lengthy, they have easy vocabulary, and they cover the key messages. Secondly, these steps come with images created by our design team, actually by Red Cross and Red Crescent volunteers that are highly talented. It's great to work with them. Some of those characters are shown here on the slide. And they're also part of a group of characters that we've created so kids can start to recognize these characters and identify with them. There are placed on standard formats as well as with consistent coloring just for continuity. And third, for the overall approach, as I've mentioned before, this is really, really about learning by playing. These activities really encourage engagement with other kids, with other family members in their household. They encourage active movement, hands-on activities, and collaboration. And these activities are available, as I said, in card format, so you can easily share them, particularly across WhatsApp or social media. They were translated by our partners, Translators Without Borders, into multiple languages, and they're shared across multiple network channels. And they're all available on our site that I'm putting in the chat box right now. Thank you for that question, Ruth. And you can see it on the slide. It's preparecenter.org/kidskit. So on the next slides, let's see if I can change slides. I'm going to highlight some of the cards because we're really proud of them and they're fun to develop and the kids really enjoy them. So these cards here are on learning protective actions, like how the first one on the left is, just to give you an example of some of our cards. We have about 30 right now, but one of our cards is this Post It and Clean It, where it's showing kids how to learn about how quickly germs spread, because they post a note on places they touch to understand that they spread very quickly. They draw a germ on the note and then they post it everywhere they touch. And they can only remove them if they clean that place first. And a second card on the right here that is in French, because we have them in many languages, is about learning how soap works with a really fun pepper experiment. And I wanted to share these and highlight them because they're two of our most popular cards. They have a lot of feedback from parents that they're engaging and kids want to repeat the activities. Who knew that they would want to repeat activities about how germs work? But it's great because that repetition, that practice, is what can lead to change behaviors. And let's see, on the next slide, this is an activity. It's called Feelings Faces, an activity from Save the Children that we took and put onto this card. It's a mental wellness and mental health exercise that allows kids to take a different means of communicating their feelings as they learn to understand how to talk about their feelings, how even to understand how they might be feeling during this time. These cards are followed by a reflection piece at the end where you think on what you're doing, what you've learned, and then you share it with your parents or your household, other kids. And this, I share this one because this has been one of our top 5 downloaded cards to date. So it's great to see a focus on mental wellness from people that are interested in the cards. Here are some other cards. These are drawing from British Red Cross activities in particular because they have a campaign for children around the power of kindness. So these are acts of kindness cards. It's called Into the Mirror and the Empathy Tree. You can find them on the site. This aims to lead to increased social cohesion by focusing on understanding empathy, understanding other people's feelings, taking them into consideration so that you care about them. You can show you care for them during this time, this difficult time. You want to protect them too. And I think that's a really important point of this Pillar 3 of the CSS framework. And lastly here on this slide, this is our 4th category. Cards around the disaster preparedness apps I mentioned. If you want to go into your app store, you can find them there. They're for a bit of an older age group. Our cards really aim for ages 4 to 10, but this is closer to the age 10. These apps have around 300 downloads per week across multiple countries. They're available in multiple languages, and we like to encourage kids to have a challenge around them. And Red Cross and Red Crescent volunteers also have challenges around them too. They can be great for anyone that likes games, even adults, so any of us could play them. Yeah, but actually before talking about next steps, I think it'd be good to tell you about the reach that we've had. The Kids Kit site that I see someone's asking about, so here it is. There's the link in the chat again on our preparecenter.org site. This site, since launching in late April, has received around 9,000 page views. It's one of the top top pages visited on our site overall. It's shared widely across social media, which is a key form of sharing the cards at the moment. And those posts have been receiving close to a reach of 6,000 views on a single activity card, just on our Twitter posts alone. And we have a total of about 3,000 followers on Twitter. And in terms of direct usage, our National Society partners have been really actively engaged with these cards. thinking of a couple examples, the Colombian Red Cross has shared these cards within their channels and based their educational interventions around the cards. El Salvador's National Society is also structuring educational programming around the Kids Kit, often through WhatsApp. And all these cards are available for free, just to answer your question, John, free and open source. We also have extended reach by Save the Children sharing, as they're very much involved in these cards, and a lot of the cards reflect their impactful activities. And also a lot of sharing through British Red Cross during their Power of Kindness campaign, where they work. They also work very specifically with British refugee communities, so their refugee services team shares these pretty widely. Yeah, these are open source. They're freely available on the site for usage by any partner. And in terms of next steps, we're always seeking new partnerships, which means that if you have activities or ideas for activities, we could work with you to assess how to communicate it in a child-friendly way and assess its impact. We're also exploring new means of dissemination, thinking about, right now they're card form that you can share across social media easily or WhatsApp, but we'd like to also take it offline, as we know many people work in a field type setting. How can we're looking to make physical paper kits of printed cards and really looking at developing new cards that are geared around back to school activities as schools start to reopen. This would all come with guidance for families and teachers on how to work with the cards with children. And these cards, answering your question, Sally, these cards are accessible by children with disabilities. We try to reflect it in our cards, particularly with Save the Children's focus. And many of the activities can be done by those with disabilities. We try to be inclusive, but we're always trying to continuously improve as well. And do I have another slide? I have a last slide. So this has been a long presentation, longer than anticipated, but I'll end here with an open call for collaboration, as we are really keen to work with new partners. And I'd like to note that this is just one activity highlighted right now by IFRC, but all of our national societies, all 192, have been very busy in the disaster risk reduction and resilience educational field, often through remote and virtual homeschooling means. So if you're interested in learning more about the kit, or the many tools and approaches across the national societies, or even how to circle back to what Marla presented on, you could reach out to her and me through this email address on how to get involved in the adaptation and adoption process of the PAPE key messages and how to apply it to these cards, to other activities. Please feel free to reach out directly. And yeah, that's the end of my presentation. Thanks for listening. I hope you find these cards useful, and feel free to put some questions in the chat box. And yeah, I will turn over the presentation now to Amba. Thank you.
Mentioned before, so due to the COVID-19, so as we know, many countries close their schools and children stay at home without their caregivers and without their support systems that they are used to. Basically, this situation raises different feelings and needs among those children and their caregivers. And because they needed to face with unfamiliar and unknown situation. So this basically understanding brought us in Israel HQ to develop Parents Toolkit for caregivers. And the idea behind it is that the importance of including caregivers in the process of building child resilience. So few points that guide us. The first one is that we all know today that caregivers' well-being will influence the ability of children to cope with stress. The second one, we know that research indicated that child resilience is directly related to strong bond with trusted adults and with the caregivers. The third one is the children rely on their parents both physically and emotionally. When the parents has high sense of efficacy, it will influence directly and assist their children. Children learn their coping styles. Just a minute, I'll just move the slide. Children learn their coping styles from their environment, and especially from their parents. So when caregivers have validated and healthy coping strategies, the child will be able to learn them even indirectly. Family bond and mutual activities providing a strong net for the child and strengthening their social network. Knowledge, also, we know that knowledge helps with the sense of control that it can provide the importance of the child resilience when we talk about the sense of control. So basically, what our kit has, we took the acronym of Share and Dream, and we can find there, first of all, tips for self-care, how parents and caregivers can use self-care to regulate themselves and also to help the children. The second one is hygiene. It's more about the information about hygiene and how you can promote it. The third one, you can find their activities, different activities that parents and caregivers can do with the children. You can find the responsibility that children can take on themselves, basically to have the sense of control that we talked about before. There are art crafts there for children, explaining the parents about the normal reaction to the abnormal situation that we are facing now, the importance of daily routine in COVID-19 when we are in lockdown or in quarantine, dedication, how we can listen to our children, relaxation techniques, and allow emotional expression for the kids, and how to see media, in a responsible way. Basically, the toolkit was implemented in most of our country, in Uganda, in Mozambique, in Dominica, in different ways. Each country adapted to their own culture. And now we will see two case studies, one from Mozambique and the second one from Dominica. So, Aurelia, you're welcome to present.
Hello all, I'm Carolina from Mozambique. I work as a program manager there for Israel, and I would like to share a bit of what we have been doing there in response to the COVID-19. So in Mozambique, we have a PSS, a psychosocial project that actually had to be almost all suspended during this COVID outbreak. And in order to keep our work and to respond to this so important time where people were struggling very much, we developed some strategies and some responses. As you can see here in this pictures, one of our responses is the distribution of kits that are that contain a coloring book with crayon for kids. In this coloring book, they have information about the COVID, how to keep safe, how to behave with that, and how they can fight the virus, even with like small actions. Also, we distributed a poster with instructions on how to wash their hands. And in this kit, not only the children were benefit, but also the parents and the caregivers. And they received the Shared Dream and Dream that Anva just presented, that is an acronym for helping them in difficult situations, about their emotions, about the activities they can do. And also, they received a hygiene component that was composed by a soap, so they can have access to hygiene and so on. Regarding that, we actually distributed it for 700 families, and it was a success. So we are now planning a second distribution. The second distribution will reach more than 12,000 families. And our partners are, of course, the Department of Education, because these kits are distributed in the schools when the parents come to collect materials for their children, or the caregivers can also come. And in partnership also with GIZ. So almost 3,000 kits of PSS support and hygiene will be distributed. And these kits will also contain buckets with tap and lid, masks, gloves, and more activities. More activities focus on PSS, because this is a difficult time and we understand people need tools to cope with that. Besides that, we also established a call center that is gonna start next week. And this call center will call to the 10% of the families that receive the kit, so around 1,254 people, families. And we aim to talk to the caregivers and the parents to see if they receive the kits, if they are using it, if they have any doubt, if we can help them, and mainly talk about their emotions. Also, if we find any acute case that need more care, we have a referral pathway that was developed with the Department of Health in Mozambique, and we can refer these people for more care. Last but not least, we developed, is still in development, we are going to implement radio sessions. These radio sessions are composed by psychosocial information. So the first 30 minutes will be devoted to the parents and caregivers, and also the other around 20 minutes will be composed by storytelling, and the last part, questions and answers. The radio sessions are very important because it's the only way to reach the whole province. So we work in one province with more than 5 districts. But due to security during this pandemic, we can only reach physically 2 districts. But through the radio sessions, we can reach much more families, people that are very far, and we can provide some help for them in these difficult times. We also have very good partnership, as I said, with the Department of Education, the Ministry of Education, and also to reach other areas that we are not working. We have partnership with IOM that is also distributing the coloring kits for these kids, and it's a joyful way to learn. So we hope to pay attention and to give care to those in need in these difficult times. And I would like to give the word to my colleague from Dominica, Dana.
So I'd want to start with a little overview of Dominica and the situation before I present to you our interventions in response to the COVID-19. Dominica is a small island nation state in the Caribbean with a population of 70,000 people. It's in the Eastern Caribbean in a region that is very prone to natural disasters. Israel arrived here 2 years ago after a devastating Category 5 hurricane and has been working with the education sector and the child protection sector since. At the eve of COVID-19, the education sector transitioned to online, and the early childhood development sector, which is mostly privately managed, was more vulnerable. Our team conducted a rapid need assessment, which was coupled with the Share and Dream toolkit that Anva just presented, and we've accordingly devised 2 strategies for intervention. The first strategy is a more general approach, general public approach together with the government, and it revolves around information dissemination. For that, we had messaging around prevention, around WASH, health, psychosocial support, mostly targeting children and their caregivers. We started with conducting webinars for the Ministry of Education and Gender Affairs on working with children during dealing with stress, everything very relevant for this period. We then did radio programming and TV programming related to psychosocial support, also in dealing with stress, a lot of information for parents and for caregivers. We've done a social media campaign and physical posters together with the Red Cross, with IOM, and with the Ministry of Education. And we're still actually continuing all of these interventions now. The second approach we took is a more targeted direct community approach. As I've mentioned to you before, in the needs assessment, we saw that the ECD sector is more vulnerable. And we've targeted a part of Dominica that is particularly vulnerable. We've done a needs assessment among 22 preschoolers. For 23 preschoolers. And we wanted to understand the gaps and the needs and the existing resources. The approach we created together with our partners in Dominica, the East Federation the East Dominica Children Federation, was based on a virtual recreational and engaging activities for children, as well as kind of tools and information for parents and caregivers. The purpose was to strengthen the family bonds and also alleviate stress with children. And for that, we've essentially created around 20 or to 30 videos with stories, recreational activities, explanations that are very subtle on COVID for children. And we've also created tools and kits for parents and for caregivers. We have distributed physical recreation kits for the kids to also have with arts and crafts, activity books, and parenting toolkits. And the virtual videos we've posted both on a Facebook group and Facebook pages, through WhatsApp groups, and now we're creating a YouTube channels. In terms of the results so far of the interventions, they were very, very, and are still very positive. With the direct community intervention, we are now still continuing the engagement with children and with parents. We'll do it through the summer. We are getting many feedbacks about stronger family ties that are being created, and it's really wonderful. And in particular, we've also managed to start creating collaborations with local creators, local content creators and service providers, and we're starting to post content of such as well, so it's really wonderful. And for the general approach, we've reached over 10,000 people from the most vulnerable areas in the country, with signage, with posters, with information. We've done collaboration with several agencies, both international and national, which was very exciting for us and also for the ministry. And we were able to also empower and continue empowering social workers, counselors, and different caregivers. The support will be continuous. We're still moving forward with it. And yeah, this is it. I think this is the end of the presentations, and from here I am leading us to the Q&A. So thank you very much.
Sharing, sending you a follow-up email will be sent to everyone. This will include a copy of this presentation, a webinar summary, and the materials and links to the recording, and also a lot of the links that we're sharing here today, to the PAPE messages, to our cards, to our kits. And with that, we will turn over to the Q&A. I'm just going to scroll through some of the messages here. It looks like there's a question from Loy. Oh, what is the requirement and guideline to collaborate? Thank you. I don't know if this question is for everyone. Marla, would you like to answer for PAPE? I don't know if Marla's in presentation mode. I will share for the activity cards. Or Marla?
You know, I think the first thing to do might be to reach out to your National Red Cross Society or your National Save the Children office. Tell them that you've heard about this and that you'd like to know more. You can copy in myself. I'll put my email in the chat and Bonnie. And once we know that there's interest, we can talk about how to do the small amount of finding of resources necessary to implement the public awareness and public education key messages adaptation and adoption process in your country. We've managed to do that for as little as I think about 30,000 US dollars for a project over the course of about 6 months max. So be delighted for any overtures on that.
Impactful activity that's evidence-based. We really want to make sure there was educational specialists involved in the creation to make sure that we're going to be putting out cards that are really useful for children and will have an impact in our safe messaging. So usually it's going to mean that you are using the PAPE key messaging. And then just feel free to reach out. I'll put my email in the chat as well. And I look forward to collaborating with you. I don't know if anyone from if anyone from IsraAid wants to talk about collaboration, but also Carolina, could you answer the question on the screen?
It's actually the development after the cyclone Idai. So we provide PSS training to the teachers to learn how to deal with any other issue, any other stressful trauma that they might have, not only like natural disasters, but also the pandemic now. And for those that we are still training, because we still have online trainings, we add the component of COVID-19 because it's what we are living right now. So yes, we like Mozambique just barely recovered from an emergency inside a pandemic right now. So all the efforts are very welcome there.
I know there were many great questions that remained, so we will make sure to get back to those in email form, along with some notes and some links. We really appreciate all of your questions and your participation today. And yeah, thank you so much. And please feel free to visit the GADRRRES website and reach out to us if you have any questions about our tools or resources. Thanks so much again. Have a great day.